YouTube Live, so just give it a second to do that. Okay, so people are taking their exams. 11th of February seems to be the main next test date, but a lot of people are taking it in March as well. April, okay, so some people are really preparing well for this. That's good. That's good. Okay, that's working fine there. Yes, OET live training. Cool. Hopefully some people come along to that. Okay, let me get up my slides here. Let me just test that. Cool, it all should be working, I think. Ha, that's good. Hello, everybody. My name is Jay. I'm one of the expert OET teachers here at E2 Language. Before we begin this class, oh, by the way, we're going to do OET writing. We're going to focus on the skill or the part of the method called selecting case notes. But when I say I'm an expert OET teacher, I have some sort of evidence to suggest that that may be true. This little logo is important. This logo is for OET providers who have undergone premium preparation provider training from the OET itself. So if you're going to attend a school or perhaps an online a website to do your preparation, make sure it has this logo, because this logo represents quality. It means that the people teaching you know what they're talking about. If there's nothing like this logo on your where your school is or whatever you're studying, just be careful, because the quality may be, well, not that good. So look for this logo. It's a good thing. And by the way, E2 Language has this logo. So you can, well, it's up to you whether you trust us or not, but you can trust us. All right, in today's class, we're going to look at the OET writing method, which is that you read the task, you interpret the case notes, you select case notes according to the task, then you organize and transform them. In other words, you write it up. So what happens in the reading time? Well, this can happen in the reading time. You need to read the task. Remember, you get 5 minutes reading time. And this can happen in the reading time as well. You interpret those case notes because you read them and interpret them. And there's also, after you've interpreted, you can, in your mind, before you start writing, is you can use the reading time to start to select case notes. Okay, so we're going to focus on this one in particular in this lesson. Now, just before I show you the task, I just have to send people in the live class the link to the YouTube live link. Anyway, let me put that in the chat. For people in the live Zoom class, if you can't see my text because it's going off your screen and looks really weird, you're going to have to watch this on YouTube Live. In the chat, there's a link, a blue link. Click that, it will take you to YouTube Live where you can watch this live, okay? All right, so imagine it's test day and you've just been given your writing case notes and the invigilator says, okay, you can start reading. What you want to do is not read the task first. You in fact want to go here. Sorry, let me get that right. You do want to read the task first. You don't want to read the case notes first. You want to start with the task, okay? So let's do that. Sorry, I'm a bit disorganized. Here we go. So here we go. It's test day. You get your case notes and you can start reading. What you need to do is skip over all of these case notes here because they won't make sense out of context. Only after you've read the task will those case notes then be in context and will make much more sense. So you want to go straight down here and you want to read the task, okay? After you have thoroughly read and understood the task, you can then go back up to the top of the case notes where you'll start to interpret the case notes, read and interpret the case notes, and think about selection according to that task. So let's have a look at this task here. Just read this to yourself. Read it again. Okay, there's actually a lot of information embedded in this in these two sentences? Let's ask ourselves some questions about this task. We want to ask these questions: who, type, why, no or not. I've just written this shorthand, but this is what you should remember. So who are you writing to? Well, you're writing to John Walker, but what does that mean? Who's John Walker? Well, John Walker is the home care nurse. Okay, that's important. So you're writing to a home care nurse. What type of letter are you writing? What does it say here? Are you writing a referral letter, a discharge letter, a transfer letter, or some sort of information letter? Well, you're writing a referral letter. Let me get out my pen and I'll point this stuff out. Let's look at who first. So who? Well, okay, you're writing to John Walker. Fine. Home care nurse. There you go. What about type of letter? Well, it says here referral. So we're writing a referral letter. Okay, fine. Why are we writing to John Walker and referring him this patient? Because John will take over Jane's home care. Okay, fine. Now, the last question, this is a really critical one. Does John know Jane? Just put in yes or no. Does John know Jane? Put yes or no into the chat. Does John know Jane? This is a critical thing to understand. Yes. Correct. Okay, for those of you who cannot see my screen properly, please click the blue link in the chat. Watch it on YouTube Live. Correct. Some people are saying, yes, John knows Jane. I would beg to differ. Let's go back and look at this. Using the information given in the case notes, write a referral letter to home care nurse John Walker at blah, 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 blah. John will take over Jane's home care. It does not say it explicitly, but it implicitly, it implies that John does not know Jane. You have to infer that. John does not know Jane. Good. Fine. Now that we've read the task and we're clear on who we're writing to, the type of letter we're writing to, why we're writing, and whether or not the recipient knows the patient or not, we can start to think about selection of relevant case notes. And I use the word relevant. I use relevant. What's the word? Purposely there, because you have to select relevant case notes, not just random case notes. So let's have a look at this. And we're going to keep the writing task in our mind while we read these case notes. And we're going to think about whether they're relevant or not. So if you need to, refer back to the task. Think about whether this, or this is relevant. I'm going to give you just 30 seconds. Okay, that's probably enough time. That was only 10 seconds. Let's go to the next one. We'll come back and discuss whether it's relevant or not. Let's go to the next one. Remember, keep the task in mind. Give you another bit of time to read this and decide whether these case notes are relevant or not. It's a little bit trickier. Let's go to the next one. Medications. Would you select and include these in your letter? Here we go. Physical review. There's a lot of case notes here. I'm going to give you 45 seconds. Relevant or not? All right, that's a tough one. Let's go to the next one. Notes and management plan. What's relevant, what's not? Is it all relevant? By the way, sorry, I just had a question on YouTube Live. Somebody said, is this for nursing or medicine? Well, these case notes are for nurses, but the concept, the methodology that I'm teaching you is relevant for every profession, physios, dentists, whatever. I mean, obviously the case notes will be different for each of you, but the concept of selecting relevant case notes is applicable to all. All right, let's go back because that's the end of the case notes. Let's have a little debate over what is relevant and what is not. Okay, so we're writing to a home care nurse, and this home care nurse does not know the patient. It's for a referral letter. Okay, so let's have a look. Well, this is going to be relevant. Of course, her name will be relevant. Her age will be relevant. Okay, fine. The clinic in which you work, probably not. If it's a discharge letter, possibly, because you would say she's being discharged from, but it's not a discharge letter. I would beg that this is irrelevant. So name again, age again, residence, possibly, but you could possibly slip that in, who lives in Jane Doe, who lives in Kensington, something like that. Possibly not. Let's just leave that as a question mark. Sorry, let me tick for relevant. Let me cross for irrelevant. Let me question mark for maybe relevant. So yes, okay, so let me do that. That will make sense. Fine, let's go to the next one. And I'm happy to, if you disagree with me, to write into the chat. You guys are the professionals here. Okay, so again, John Walker, home care nurse. He doesn't know the patient. A referral letter. Date of visit. Well, I'm going to say irrelevant. He doesn't need to know when Jane visited your clinic. Medical history. Okay. Born premature, cerebral palsy, 2 weeks old stroke, caused cerebral palsy, non-ambulatory. I'm going to say this is not relevant. I'm going to say this is relevant. I'm going to say this is not relevant. I'm going to say this is relevant. I'm going to say this is relevant. Okay, it's enough to probably say to John that Jane has cerebral palsy. He doesn't really need to know that she was born premature or that a stroke caused the cerebral palsy. What about past surgical history? I would say irrelevant. Family history, irrelevant. Social, lives alone, possibly. I'm going to give it a tick, not a question mark. When she gets up and when she goes to bed, I'm going to leave a question mark. Can use a computer phone dictation software. I'm going to leave a question mark and think about that and possibly add it later if it comes up while I'm writing. Uses Medicaid wheelchair van for medical appointments. Yes, I'm going to say so because there's something about mobility in here that's important for John. Has rehabilitation aid, handles shopping and errands. Okay, so the rehab aid handles shopping and errands. I'm going to say that's relevant. I'm going to jump in here and say, okay, the thing with selecting case notes is you may have 2 letters that both get an A, or I should say a B. Let's just say a B in the OET. And they may have slightly different case notes selected. So it's not like a test where if you miss one, you will lose marks. Some of them are absolutely critical. You can think about it like a scale. There are some case notes that are critical. There are some case notes that are possibly should be included, possibly could be left out. And then there's ones that are definitely irrelevant. So if you do include some of the middle ones that are sort of ambiguous, that's possibly okay. If you leave some of them out, that's possibly okay as well. I think what's important are the critical case notes and the non-critical case notes, the inclusion of these and the exclusion of these. So yes, medication. So does John need to know that the client manages own meds? I think so. And medical scripts filled at Rite Aid delivered by pharmacy? Well, possibly. Okay, physical review. Does John need to know that Jane is 5 foot tall? Probably not. Skin intact? Probably not. It's unremarkable. Appetite good? It's unremarkable. Probably not. Let me cross these out. No difficulty chewing or swallowing. It's unremarkable. If it said difficulty chewing and swallowing, I would certainly include it because that sort of becomes something that he would want to know. Vision, astigmatism, near and far-sighted. Well, near and far-sighted, is that enough to include, or is this sort of unremarkable? Wears glasses. I'm going to say not relevant. I'm going to say not relevant. Hearing and speech within normal limits. I would like to know that if I'm the home care nurse. Occasional bladder incontinence, I want to know that. Wears incontinence briefs when out for long periods, I'd probably want to know that, although I don't really need to know that. Continent of bowel, I'd probably include that. I'd probably include all of this in one little sentence or phrase. Toileted via mobility lift, I want to know that. Upper extremity, left hand functions pretty well, right hand immobile. Possibly important. Receives, I'm guessing this is physiotherapy weekly. Improvement noted in flexibility and strength to right leg. Relevant. Well, for my home care nurse, probably not. I'm going to leave it out. Left leg remains weak, probably relevant. Moderate core muscle strength, probably irrelevant. Client stretches in bed to keep self limber, probably irrelevant. Now, let's think about these. If John Walker was not a home care nurse, but if John Walker was in fact a physiotherapist, imagine how much this changes your selection of case notes. Because all of a sudden, all of these case notes that relate to her physical body become extremely relevant. Notes, diet poor. Well, it depends on the management plan. If John's looking after her meals, I guess it might be worth including. Let's just think about that one. Requires aid increase once a week, 1 hour a week. I don't know if that's relevant to John. Let's keep reading. Let's cross that out. Aides do not have enough time to complete personal care and other tasks. Okay, so I'm going to say that, let's keep reading. Poor upper extremity and lower extremity mobility, requires assistance 7 days a week with bathing, showers, PM care, grooming, dressing, transfers, toileting, meal prepped, breakfast, lunch, and dinner help. Yes, I'm going to say that all of this is certainly important for John because that's what we want him to do. And that's going to be part of your introductory sentence when you write to John and say, I'm writing to refer Jane into your care, or she requires your assistance with X. I would also include this in the final paragraph as part of the management plan, and a nicely written paragraph asking John what to do, or sorry, telling John what to do. Now let's go back and think about this one here, requires aid increase. I don't think it's relevant. That's something else altogether. Now you might have some different ideas about that. That's fine. That's not the point of what I'm doing. Now we're going to do it again. I'm going to change the task, and you're going to see how the task affects those case notes and your selection of case notes. So let's look at this task. Please read this task. Please read it again. Okay, just before we continue, if you're on YouTube Live, click the subscribe button down below, or if you're just on YouTube, click the subscribe button. What that will do is every time that I'm doing a live class, you'll get a notification on your phone and you can watch it live. So that would be very helpful. Also, if you're watching this and you're enjoying it, leave a comment and click like. That would be also very helpful. All right, so this time we're writing, it's the exact same task, except the occupation, John's occupation has changed. Now we're writing to a physiotherapist. So we can see that we're writing to John, physiotherapist, still a referral letter. We're writing to him because he'll take over Jane's physiotherapy needs. And we can assume that John does not know Jane because it's written in the same way, okay? Now we're going to select relevant case notes. I'm just going to walk you through it. So this time it would be the same as before here. Okay, now we're starting to see some different things. All of a sudden, this becomes extremely important, doesn't it? What else becomes important? I still think that that's important. The cerebral palsy, that's definitely important. The past surgical history is unimportant. Family history unknown is unimportant. What about here? Physiotherapy. Okay. Yes. Okay. That's fine. I would include that one. Has rehabilitation aide who handles shopping and errands. Okay. I would include that because we're not asking John to handle shopping and errands. Medication, probably less important now for the physiotherapist, maybe even unimportant. Whoopsie. Let's go to the physical review because all of a sudden this might become important. Height, I still think is irrelevant. It's unremarkable. Skin intact. Okay, these are still unremarkable. Sight is unremarkable. Hearing and speech, possibly. Incontinence, I still think is relevant. This is still relevant. Okay, now it gets interesting because the upper extremity left hand functions pretty well. Right hand immobile becomes very important. Left leg remains weak. Moderate core muscle strength is all of a sudden important. And the fact that she exercises in bed is also important for the physiotherapist. Diet poor. Well, does the physio need to know about this? It possibly might be worth mentioning. Here, we've got the same thing. I've added an extra little case note here that says requires physiotherapy weekly, and this would all of a sudden become important. Here, though, that she requires transfers, toileting, meal prep, etc., all of a sudden becomes unimportant because we're not asking the physiotherapy therapist to do the job of the home care nurse. Okay? Keep that in mind. Let's change the task a little bit more and go through it again. This time we're writing to a social worker. Okay, so John Walker now is a social worker who's going to attend to Jane's, psych and social needs, psychological and social needs. Very interesting. We're going to look at these case notes very differently. So John Walker, social worker, referral letter. He's going to look after her psychological and social needs, and he does not know her. Let's select case notes according to this task. Whoops. Okay, so yes, same as before. The name and the age is important, possibly where she lives. Okay, here we go. So psychosocial. Psychosocial. Yes, I would say cerebral palsy is still important. I would say that she's non-ambulatory is still important. She uses a power wheelchair. Unimportant, unimportant, lives alone. All of a sudden, the social notes become relevant. I think that's particularly relevant. I think possibly when she gets up and when she goes to bed, I think that she uses particular software to help her communicate becomes important. The Medicaid wheelchair van for medical appointments all of a sudden probably becomes unimportant. The rehab aid is possibly worth mentioning. I'm not sure about that one. Manages her own medications. I think that's probably important. The second one, that they're filled and delivered by the pharmacy, is probably unimportant. Let's have a look at the physical review. Height, no. Skin intact. Appetite, swallowing. Vision, no. Hearing and speech within normal limits probably becomes important. Incontinence, a psychosocial worker would probably want to know about that. Incontinence briefs, continent of bowel. Toileted via mobility lifts. Yes, he probably wants to know that. I'm going to put that a question mark though. Here, the physical aspects, what I would do here is I would summarize this into a single short sentence. I wouldn't be so specific. Maybe he wants to know that she has physical ailments, but doesn't need to know the specifics of it, okay? Diet, poor. All of a sudden, a psychosocial worker should know about a poor diet because that will affect her mind. And if we look closely here, I believe I added something. Did I? Whoops. No, I forgot to do it. I was going to add a case note here about depression. Okay. And that, of course, would be extremely relevant and possibly that embedded in the management plan. But I don't want to look at these too closely. That's all for today, guys. If you need help, go along to e2language.com, www.e2language.com. You'll see the website in the description below this video. Sign up for a free trial. If you need extra help, you can always upgrade at a later date. Anyway, hope that was helpful. I just wanted to show you the importance of reading the task and the effect and the influence it has on selecting case notes. If you have any questions, put them into the chat. Okay. Jay, here's a question on YouTube Live. Jay, when we write the letter, can we use abbreviations or not? It depends what the abbreviation is, whether it's common and who you're writing to. So let's say you're a doctor and you're writing to another doctor, then it would be appropriate to use abbreviations, common abbreviations. But if you're a doctor and you're writing to a social worker, for example, should you include medical abbreviations? Probably not, because the social worker might have difficulty understanding those abbreviations that are particular to your profession. Okay, so think about, again, who you're writing to and whether that would be appropriate. Okay. Jay, if they give the year of birth instead of the age, what should we write? Okay. Let me show you. Okay, so usually, I'm sorry, I don't have a blank page here. Usually we write full colon, Jane Doe, comma, aged, I forget her age, she was 28, I think, age 28. Usually we write this, but if they give the date of birth instead, don't worry about this. All you write is DOB, and let's say her birthday is 11th of the 5th, I don't know, whatever that is, 1990. Okay, and that would be fine as well. So that's how you do that. Jay, please give us a few effective linking words to score well. Okay, well, linking words won't really help you to score well. They're just cherries on top. You need to write grammatical sentences, use precise vocabulary. You may want to think about getting some feedback if you're hoping that linking words will solve your problem. Okay, cool. Let's go into these case. Jay, what happens if we exceed the word limit in writing? The word limit's between 180 and 200 words, and it's the body of the letter. So it does not include the address and the Dear John Walker or the re. It starts with the introductory sentence, I am writing to refer Jane Doe, and ends with the yours sincerely. That's the body. That's between 180 and 200. The OET are not particularly strict with word count, so you can be a little bit over. Probably better to be over than under, I would say. Jay, how many paragraphs would you write for writing? How would you use for writing, apart from the introduction and conclusion? Usually 3, I would say. So you write your introductory sentence, I'm writing to refer Jane Doe into your care who requires physiotherapy needs. Then you would go straight to the main issue, which is Jane Doe requires physiotherapy. She has a hand and leg issue, whatever. Then you would write a paragraph about miscellaneous important information. And then the third paragraph would be the management plan, the discharge plan, what you require the physiotherapist, the doctor to do. Okay. So usually 3, but you need to be flexible. It may be 4, maybe 2. It's up to you on test day. It depends on the case notes. Jay, when we write a transfer letter, do we have to write the date as it is in the letter, or can we use the exam date? Okay, Juby, so you'll be using it's a bit tricky. The case notes that you practice with and you get always have a date that's old because they were created and then time passes and they become old. On test day, your case notes will be on the day of your test. So it'll be written. So yeah, let's say you're writing a referral letter and you're just writing the date. You'll write today's date, the day of the test. Let's say you're writing a discharge letter. You'll write at the top or somewhere about today's date. That's fine. You need that. But let's say you're discharging the patient. Let's say today's date is the 18th of January. Okay. So at the top of my letter, I'm going to write 18th of January or 18/01/18. Okay. Let's say the patient's being discharged on the 21st of January. So I would say I'm writing or patient X will be discharged on the 21st of January, 2018, back into your care. So you will include the date. Don't worry, it all makes sense on test day. It just doesn't make sense when you're preparing because the case notes are old. Okay, Elney wants to know, in the reading time, am I allowed to ask questions about the case notes to the examiner if I don't understand them? No. The abbreviations won't be, even I'm not medically trained. I can't understand the dentist ones. The dentist ones are crazy. The medical ones, I struggle. The nursing ones, I can understand. Some of them I have to look up on the internet, but you guys should be able to. It shouldn't be a problem for you. Cool. Do we need to write our name at the end? You just write nurse, dentist, physiotherapist, etc. You don't need to write your name. Good question. In the reading time, are we allowed to use our pen and put a cross or a tick next to the case notes? The answer is no. Please correct me if I'm wrong. I don't think you can. You have to do this mentally. That's why it was good practice today, just to look and think. But certainly after you've looked and thought, you can go back and tick. All right, just a quick little look on YouTube Live. Don't worry about that either. Do we need to mention separately in every paragraph, introduction, body, conclusion? Not sure what you mean by that. Cool, I'm going to leave there. Guys, if you need help, check out e2language.com. Don't do this alone and don't use poor materials from the internet. That will put you off track. You want to go on track towards a high score. It may mean you need to spend a little bit of money on preparation. It's a much better idea than taking this test and unfortunately failing it, which a lot of people do. So think about that, and I will see you guys soon. Thanks very much for coming.